Hello, I'm Dr. Leibovitz, and these are the instructions for your taping. The tape will be on for approximately 4 to 5 days, and it's very important to follow these instructions to make sure that it stays on that long. One of the things we're going to need you to do with the taping is to have a diary, and that's going to tell us how much relief you get from the problem that you're having. What we'd like you to do is pick the symptoms and the level of symptoms you had prior to the taping, and that's what you're going to compare each day to. And every day you'll write down a percentage of improvement. So if I see 0% improvement on the diary, I'll know that there's been no change and it feels just like it did prior to the taping. If I see 20 or 30%, that's a small margin. 50% is halfway. 100% is no pain. So kind of use that as a guideline of how to rate your improvement. During the diary, I need normal activity. That's very important to judge how well we're going to do. If you have diminished activity, you're going on vacation, or you're just going to take it easy, we won't get the full effect of how well the taping works. You'll improve from the rest, but not from the taping. So please maintain normal activity. And if you see improvement after the second and third day, you're welcome to increase your activity to really test the taping out. Now this is a special tape. It's a hypoallergenic tape that's going to be less reactive to the skin, but be cautious. Somewhere somebody's going to react to it. If you feel there's a burning, an itching, or blistering occurring, what I want you to do is peel off the edge of the tape, look at your skin. If you see a rash developing or any skin irregularities, go ahead and take it off. It's not worth having a secondary problem. The other important thing is we have to keep this dry. If the tape gets wet, it's going to fall off immediately. So we have to take precautions. So what I want you to use is a plastic garbage type bag and duct tape. Plastic bread bags and rubber bands won't work. It will leak, and if it leaks, it gets wet, it's done, and there's no way you can reapply the tape or retape it to make it very secure. So remember that. Now another thing too is you can develop hot spots, and they can be focal areas of irritation, and it's going to feel like a burning either under the first or fifth metatarsal or in the back of the heel. If that does occur, peel off a small portion of the taping, see if that doesn't release it, then reapply the taping. If it's too irritable or too much of the tape comes off, please remove the taping. It's not worth having a secondary problem. What we're going to need you to do also is a break-in period. The first day that this tape is on, it's going to be very, very snug. It's going to be very tight, and we have to let the skin kind of get used to it and have it stretch out a little bit. So don't maintain full activity on the first day. Give us a break. At least give me 1 day of lower activity, and then the next day you're back to normal activity. I also need you to add a powder to the taping, and that's for several reasons. That will keep you from sticking to every piece of dust, dog hair, and lint for miles around, as well as including sock fuzz. Otherwise you'll look like a big swifter at the end of your foot. The tape goes on, and that will go on twice a day. After the tape goes on, what I want you to do is take the taping and rub it down from your toes to your heel. Like any adhesive, the more you apply it, the better it will stick. And if you do a very good job of this, at the end of 5 days, this is going to be on you like your own flesh. So don't try peeling the tape off. You may peel off pieces of that. So what you do at the end of 5 days is just get the tape wet, let it soak, and it will come off very, very easily. Now, in addition to the instructions you're going to get with the taping, you're going to get a list of codes and diagnoses that you can check with your insurance company, because this is a test for a device called an orthotic. Depending on how well you do, that may lead us down that road for treatment. And that will give you a good idea of how your insurance companies will handle orthotics. The other thing that will be very helpful, and it's really an important factor, is the tape is helping to control your foot, but in addition, there are certain parts of the shoe that will also be beneficial. And that part is right at the part that covers the heel, and I want you to squeeze that, and if it does not move, that's really good. If it's flimsy and you can move with your fingers, it's not going to be very, very helpful. So squeeze that heel. If it doesn't budge, that's a good shoe for this particular problem.